Today we're going to talk about ABG. I know everybody, you may have a method how to take care of these kind of questions, but this kind of ABG is beyond interpretation. Basically, we're doing something that you're not just identifying the ABG, but you also trying to figure out what is the clinical implication. So let's get through some few questions, and then we'll answer some questions and apply. I know ABG is a very interesting topic. Everybody have multiple ways of doing it. This is a little bit of concept. I'll just go over it quickly. When we talk about ABG, we're talking about acid-base status of your body regarding your pH level, what it should be, your PCO2, and bicarbonate. When the pH changes, your body doesn't like it. Whether it goes up or low, things changes. There's two organs that is responsible for ensuring that this pH remain normal. So one is from your lung and one is from your kidney. And they regulate all this information for you. There's certain norms you have to know. Your body tries to maintain your pH as 7.35 to 7.5. This is what the pH is usually trying to be maintained. Your CO2 is usually maintained at 35 to 45, and a bicarbonate 22 to 26. The CO2, the lung is responsible for maintaining it this way, right? And then the bicarbonate, the kidney, is the one that is responsible. So any changes of this will affect the body. And based on that, we can figure out your pH. How do you calculate it? There's easy way to do that. You can do so many methods. I just go by the numbers they've given you, and then you can figure it out. So the easy way I calculate the ABG is to focus on the numbers I give you. All I do is I just use the pH of, I don't use the range, 7.4. That is normal. The PCO2, I just use the average of it, right? From 35 to 45, I just take the 40. And then bicarbonate, I just take it to 24. So this is the numbers I use. If higher than 7.4, it's automatically a base. If less than 7.4, is an acid. That's all. And based on the number that changes, whether the CO2 goes up or bicarbonate goes up, you can determine if it's an acid. When you have acid, the CO2 need to go up, or the bicarbonate need to go down. When you have base, this bicarbonate goes up and the CO2 go down. So this is the way you can figure out, and then you can calculate what is the problem. Calculating is not enough. You got to be able to look at the clinical situation. So one of them is this question, right? A nurse cares for a client with prolonged vomiting for what? 3 days. Which client is likely to exhibit which ABG results? Like I said, it's not only identifying the ABG, but apply clinical thinking about it. What is the issue here? There is an issue here they're trying to tell you that you got to pay attention to, right? There's an issue here. I told you the patient is vomiting for what? 3 days. This is your answer. You should know that when somebody is vomiting, they're getting rid of their acid, and therefore they have to be a base. This is the key concept. It's a base. It's like if I put an NG tube into you and I suck everything, you're going to have what? A basic situation, right? So mostly your pH now has to be a base. That's all. The rest is history. If any patient vomiting for 3 days is going to be a base. And I know my pH is 7.4, normal. If I'm greater than 7.4, I have to be what? A base. And I look at the answers. I said, oh, this is less than 7.4. So this is eliminated right away. This is 7.4. This is normal. This is 7.3, less than 7.4 is alienated. And therefore, this is the right answer. I don't even look at the rest. You can also go back and say, okay, if I'm really trying to check, if you're going to be a metabolic alkalosis, then bicarbonate is supposed to go up, right? This has gone down. It can be. This is within normal limit, and this is also within normal limit. This has gone up. So this is metabolic alkalosis. And this is how you can apply your clinical ABG. So ABG beyond interpretation, basically clinical understanding of what is going on. So any patient vomiting for a long time, you should expect them to have a basic ABG. And so number one is the right answer. Okay. So next question. Which results should the nurse report to the healthcare provider immediately? Same thing. You got to think. This is a form of prioritization, right? A nurse is reviewing ABG results for a client with what? Chronic COPD, chronic obstructive pulmonary disease. Which results should the nurse report to the healthcare provider? What do you think? If you know the answer, you can put it down, but think about it. Think about what you're going to do and how you're going to go about it. Think about it, the whole idea about what is going on with this particular patient. What is the name? A nurse is reviewing arterial blood gas, okay, for a client with chronic obstructive pulmonary disease. Which results should the nurse report to the healthcare provider? So which of these would I report to the healthcare provider? Based on the information that I've given you, you can figure it out, everything that associated with this problem easily, right? So what is going on? I said, which one is bad? A COPD patient, what do you think? A COPD patient, usually they live in a 60-60 club. If you see a 60-60 club, then you have a problem. You know that the CO2 is going to go up, right? So they live in this situation. Look at it. This isn't is normal pH, but still you consider it an acid, but it's better, it's closer to 7.4. This is way away from 7.4. And then this is almost normal, right? And this, so you can say that we have all of them close to a normal pH as much as possible. But what is going on? CO2 50 here, 60 here, 45, 52. And the PO2 is the key. The PO2 of the partial pressure of oxygen has to be between 80 to 100. So even though all of them look like a normal pH, somebody is retaining and somebody is not having enough oxygen. Which of this are you going to report it immediately to the healthcare provider? It's based on the CO2 that is given. This is ABG beyond just interpretation. They all have a normal pH, but somebody is retaining CO2, which is going to affect their respiratory drive. And then their PO2 is also low. So this is a B is the most dangerous patient. So you can have this. At the same time, look at the pH, 7.31. It's moving away from 7.4. It's more acidic than the rest of them. Don't run away from this. These are not that difficult questions. Sometimes you see compensation. I'm going to show you how I do the compensation. You can have your own method, but there's an easy way to approach it. Always start with the pH, right? The pH is what? 7.4. They say, and let's review the following ABG. Which interpretation is the most accurate? So I start from 7.4. The pH is less than what? 7.4. If you use the range, you think this is normal because the normal is 7.35 to 7.45. But when you calculating, you got to ignore the range. 7.36 is an acid, so I know I have acidosis. Then you ask yourself, what is creating the acidosis? Is it the CO2 or the bicarbonate? If I know that the CO2 is creating the acidosis, the CO2 should go up. It has gone up, right? From 45, right? Bicarbonate, if it's an acid, it should go down, right? It went up a little bit. Therefore, it's not responsible. If the CO2 is responsible for the acidosis, because CO2 is the lung, this become what? Respiratory. Respiratory acidosis. That's the first thing you do. Respiratory acidosis, right? Now, how do you do the compensation? You know, we never touch the bicarbonate. So the bicarbonate we're going to use for the compensation. But how do you do that? You got to flip it. A respiratory problem now become metabolic. And acidosis become what? Alkalosis. Therefore, I'm looking for metabolic alkalosis. Metabolic alkalosis means the bicarbonate should go up. Did it go up? No, just a little bit. I mean, it doesn't go up that much, right? It does not go up that much. It went up a little bit, but what did he do? He made the pH normal. Since the pH is closed, right? The pH is now closer to the 7.4. I know something is good. Then you go look for your answer. Respiratory acidosis. Yeah, we're dealing with the respiratory acidosis, but this is not uncompensated because the pH is normal. There's some form of compensation. We know this is not a metabolic acidosis, then that eliminated. This is not metabolic alkalosis. Things is uncompensated is wrong, therefore we got to pick a fully compensated state. So this is a fully compensated respiratory acidosis because the pH is normal, bicarbonate is going up, and the CO2 is going up. This is the way you can do the compensation. So when you see them, don't run away from them. I'm going to do a little more of them, and you can see how it's easy to calculate. You may have some other method where you have to draw a diagram. This is the clinical application of ABG and what it means by that. Okay. This is the same thing. This is the second one so that you can see how you calculate it. You can try, then you can put your answer down and see. A pH of what? 7.29. A client with what? Acute kidney injury as the following ABG. And you have 7.29. And bicarbonate, and CO2 is 32 and bicarb of 18. Once again, start from the middle, write your pH. Your pH is what? 7.29. This is what? Less than 7.4. Therefore, I know that this is an acidosis problem. That's the first one is taken care of. So this is an acidosis problem. What is responsible for the acidosis? Is this the CO2? If CO2 is responsible for acidosis, it should go up. It has not gone up. It went down. Therefore, I know this is not the problem. The problem is the bicarbonate. If bicarbonate is creating the acidosis, bicarbonate is what? Metabolic. So this is a metabolic acidosis problem. Just by that, I can eliminate. I see metabolic acidosis, I'll keep it. Metabolic acidosis, I'll keep it. Respiratory is gone. Now, how do you calculate the compensation? I said flip the numbers, change the numbers. A metabolic situation will give you respiratory. Acidosis situation give you alkalosis. Therefore, you're looking for respiratory alkalosis. A respiratory alkalosis means your CO2 should go down. It has gone down, right? How much did it go down? A lot, but the pH is still not normal. If the pH is not normal, it cannot be fully compensated. You see the trick? Therefore, I will eliminate that. If the CO2 went down, it cannot be uncompensated. It means it's trying to compensate. Your body is trying to compensate. Therefore, just by elimination, A is the right answer. But this is the way you do these ABG calculations. Like I said, you have to apply this clinical aspect of it to be able to know what is going on with these patients. This is the same thing. Number 5, a nurse is caring for a client with what? Prolonged vomiting. The same thing that we saw, patient is vomiting. Therefore, you have a clue what you should expect. But just try to calculate what is the ABG going to look like. This is what I've given you. You can like practice on your own and put down your answer and think about it. First of all, pH 7.45. Start from there. Therefore, this is what is greater than 7.4. Therefore, this is an alkaline, alkalosis, right? Ask yourself, what is responsible for the alkalosis? Is it the CO2 or the bicarbonate? If I know CO2 is responsible for alkalosis, it should go down. It has gone up. It's 48. Therefore, I know this is not the problem. This has to be the problem. And since bicarbonate is a metabolic problem, I put metabolic here. That's all. You finish. You don't have to worry about any other method, flipping things, flipping down. That's all. But then, since the question is asking about compensation, you got to change metabolic to what? Respiratory. Alkalosis to acidosis. Now, look at your CO2 and see if it acting like respiratory acidosis. That's all. Is he acting like that? Yes, it went up. So it's acting like respiratory acidosis. Does the pH become normal? Yes, it become normal. Therefore, this become a fully compensated problem. But the original problem is metabolic alkalosis. Therefore, this is not it. This is not it. This is not. So C is your right answer. Is it difficult? No. What you need to do is just to see how they calculate the thing and how you look at the situation. ABG prioritization. Try your luck, put down your answer. Let's think about it. And then receive the following ABG report. Which client should the nurse assess first? Have you seen ABG prioritization? Who are you going to see first? Which patient? Somebody with the pH of 7.38, CO2 55, and bicarb 33. pH of what? 7.0, CO2 50, bicarb of 20. pH of 7.34, CO2 of 30, and that. These are conditions that they've given you. The trick is first look at the pH and see if this acidotic or basic. Acidosis is worse than basic. So I always lean towards somebody who is very acidotic. When you become acidotic, you're hypoxic. And that is more likely to cause problem than any other thing. So I'll pick anacidosis over an alkalotic state. Then you can look at a CO2 and a bicarbonate. That's all. So who is more acidic and who is not, right? Who is more acidic and who is not? This is pH 7.38 and a CO2 55 and that. So this is a normal. The CO2 went up, right? This is what is responsible. This is respiratory acidosis with metabolic compensation. Look at this. This is 7.3, which is acidosis. I know if it's an acid, the CO2 should go up. So the CO2 went up. If it's acidosis, the bicarbonate should do what? Should go down. It has not gone down. Something is wrong. It went down a little bit, not that much, from 22 to 20. So it has gone down that much, and not that much, but it has gone down. So something is wrong. If the CO2 goes up, this should go down really low. You need to compensate it, but you have a problem here. Look at this. This is normal. This is what acidosis caused by this, and this is having respiratory problems. So this is compensating. Same thing, 7.3. You have this and that. Who is responsible for that? Think about it. Who is responsible for that? This is normal, right? But if you think about it, it's an alkalotic, right? This is responsible or this is responsible. If you think about it, one of them is responsible for that. But at the same time, as I've told you, the trick is to look for an acid rather than the base. Therefore, this is more sicker than all of them. These are some of the ways when they give you a bunch of information, you have to figure out what is going on with the patient and how to manage them. So B is more sicker than the rest of them. A few of them, then I'll let you guys try some of them and see. And this is one of the ways you can ask questions. A client is caring for a client with what? Sepsis and respiratory failure. So two problems. The ABG results is that pH of that, CO2 of 65 and bicarb of 19. If you look at it, what is the problem? Of course, you know this is an acid, right? That's the first thing you do. But then you got to work your way through and see whether it's a metabolic problem or a respiratory problem. What do you think? Which of this is responsible? So what is the main problem? Is the CO2 responsible for these acidosis or the bicarbonate is responsible for that? Think about it. This is a hard one. This is a hard one. Look at it. The pH is 7.21. That's an acid. The CO2 went up. So that is causing acidosis. So you say, oh, it's respiratory. If it's respiratory, the bicarbonate also went down. If bicarbonate went down, that is what? Metabolic. So is this a problem? Because you know, if you have respiratory acidosis, you should compensate with what? Metabolic, right? Alkalosis. But metabolic alkalosis, the bicarbonate should go up. It has gone down. This is one of the questions you should watch for. We have a pH of 7.21, which is an acid, but we have two things contributing. CO2 is contributing a respiratory problem. Bicarbonate is compensating metabolic problem. So you have two things causing acidosis. This is a mixed acidosis. So this is one of the situations. You get a mixed acidosis, and that is a C problem. So watch for that. What kind of questions when you see that there's both a respiratory acidosis and a metabolic acidosis. 3 more. Try your luck and let's do this. Let's see. Let me see what you think. If you know the answer, you can put down in your comment, and then we can work through it. So I'll show you how I do these things. You can use your own method. But NS is assessing a client in the emergency department with acute panic attack. Patient has panic attack. Which ABG will be expected in the client experiencing acute panic attack? This is the clinical question. You don't even have to look at the ABG. You can use buzzwords. You can use content related. And that is this, panic attack. So if I'm having panic attack, how should that look like? That's all. What do you think? If I'm having panic attack, I should be not sitting down chilling, right? The individual situation changes. If somebody is having panic attack, they are hyperventilating. If you are hyperventilating, something is going to happen to your CO2. Your CO2 goes down, right? And that creates a problem of respiratory problem, a respiratory alkalosis. Which of these situations is a respiratory alkalosis? That's all. Which of this is respiratory alkalosis? I see a pH of this 7.3, that's an acid. 7.31 acid. This is still an acid, even though it's within normal range. So just by elimination, you can use this. Don't guess. You see, you can just analyze the question and say, okay, the situation is a panic attack. I'm hyperventilating. I need to see a respiratory acidosis, alkalosis. You look at the answer, you can see. And you can see that the bicarb, the CO2 is down compared to this. This is an acidosis problem, this and that. But this is the way you can apply a clinical situation to answer these kind of NCLEX questions you may see ABG. So this patient, that's his problem. So the patient is hyperventilating. And I know you know this. A mechanically ventilated client has the following ABG. Patient is intubated. He can't do anything. And we intubate the patient. And this is the ABG that we got. We have a pH of 7.51. We have CO2 of what? 28. Bicarb of 25. I want you to calculate. Tell me what kind of ABG situation, what kind of acid-base status this will lead to. First of all, I'll take the lead. You know the pH is high, therefore this is an alkaloid. So alkalosis. Right? What is responsible for the alkalosis? Is it this or that? If it's by CO2, it should go down. It has gone down. Bicarbonate is normal. Alkalosis, it should go up. Therefore, it's not responsible. So therefore, you know this is a what? A respiratory alkalosis. This is the same thing we did the previous question in the different form. So you have respiratory alkalosis. That means this patient is hyperventilating on the vent. How are you going to solve it? Increase the arterial volume, increase the respiratory rate, increase what? FiO2 or decrease respiratory rate. If I have hyperventilation, I should slow down. If I'm going to slow down, well, do I increase my tidal volume? Or do I increase my respiratory rate? Or do I decrease my respiratory rate? Or do I increase my FiO2? Test taking strategy, we're talking about not oxygenation. Therefore, we don't worry about the individual sites. Therefore, don't pick this. FiO2 will help with the sites. Another test taking strategy. You see the word increase and decrease in the same thing, respiratory rate. That means one of these answers are right. Third one, if the CO2 is already low, if you increase tidal volume, it's going to go low and low and low. It's going to worsen the situation. Therefore, that one is eliminated. One of them has to be the right answer. Increase or decrease. Where I want to increase my CO2. If I want to increase my CO2, do you decrease your respiratory rate or do you decrease your respiratory rate? If you're hyperventilating, you're breathing very fast and you decrease your CO2. If you want to slow down, we calm you down, you breathe slowly and you increase your respiratory CO2. So decrease your respiratory rate and then increase your CO2. You see how this question is all clinical. And that's the way to go about it. And the last question. You know about this already. DKA patient, you know what to expect. A client with the DKA has the following ABG, right? What are you going to do? A pH of 7.2, a CO2 of 25, and then bicarb of 10. Think about it, right? 7.22, that's what? An acid. What is responsible is the CO2. CO2, if it's an acid, it goes up. Therefore, it's not that problem. Therefore, I know this is a metabolic problem. If it's a metabolic problem, I got to see if there's compensation because of the answers. Metabolic become respiratory. Acidosis become alkalosis. Therefore, I'm looking for what? Respiratory alkalosis. Respiratory alkalosis means your CO2 should go down. It has went down, way down. But the pH is not normal. That means it's partially compensated, not fully compensated. Therefore, we have metabolic acidosis, partially compensated. These are 10 questions to help you understand ABG, clinical situation, calculating compensation, uncompensated. Thank you for watching, and good luck.